Turn the recording on, and so the conference comfort agreement can be found on page 7 in our conference program. If you are in need of any extra support, we have peer support for peer support specialists. Please go to our website for a list of on-call peer support specialists. We are also using rev.com for our closed captioning. So if you hit the drop-down box, if you're interested in using that, and then you can decide whether you want it on, want it off, what size your font is. And now I am going to let the folks from Quest introduce themselves. Thank you.
Good afternoon, everybody. Thank you for showing up. My name is Brian Allen. I am a lead peer specialist with Quest. I work in the HIV services department and with the peer program, peer support program. Glad to be here and of service. So, Kim, Stacy.
Hi everyone, I'm Stacy. I am a peer Wish Wellness peer, or Wish Wellness peer, and I work in the Wish department. It's a pain management department at Quest.
And I am Kim Accord. I work in the FSR department, which is the drug and alcohol treatment program at Quest in Portland. I'm glad to be here.
All right, we just want to share a little bit of Quest, and we have a video or whatnot that just to show you somewhat about what Quest is doing in the community. Could you play that, please, Marianne?
Last December, I was just in a really hard place, just very dark and isolated and not knowing what to do or how to move forward. I was alone, like I was alone.
Then we were on the verge of homelessness or homeless a few times, and just being low income, just addiction issues, single parent, trauma. It was just a lot.
I'm a survivor of childhood sexual abuse. I contracted HIV, and that's where I really started to just explore the world of illicit drugs. I don't know if I really want to stay around for this, and really contemplated ending it.
When I was a child, I was a member of the LDS church and realized that I was gay. If the church didn't accept me, how's the gay community going to accept me? And so when the drugs came along, I didn't care if I fit in. That's what I've been doing the last 5.5 months, is working on recovery. And it was done. I was done.
Quest was like a lifeline. Suddenly I had things that I could do, ways that I felt like I could help myself to keep moving forward. It's just like this world opened up.
It's like, have you heard of Quest? Quest has yoga and acupuncture. I'm like, what's Quest? What? No way.
I mean, it was all kind of surprising, all the things that were available.
They hook you. You go in for one thing and then you hear, oh, they do this, they do this too.
Opening up to the uniqueness of each individual person and how it's going to look exactly your own way every time. And the more space there is for that, the more potential there is for the growth and the healing.
They really want you to experience life and not just go into treatment.
I love that sense of community that's being built. That's very new to me, where like I can walk in and I like have people that know me, that are smiling to see me and I want to be with. And I love nutrition. I love helping out with it.
Companionship, just community talking.
Why I like it so much. It reminds me of my grandma's cooking, because she'd always cook for the family. And then watching her face glow with watching us enjoying the food.
There is no place like this place. There really isn't.
It's really powerful. Then feel so like taken care of, and yeah, valued is a good word for it.
This is a family here. It's not just a business, but it's a family.
Feeling this shift, and I just see how everything has come together to keep me moving forward, to enter into this new stage in my life, and how Quest has been like such a key piece in that.
You know, going from a little gay boy in an LDS church, not fitting into a community that accepts me for who I am is a big deal for me.
Today, because I'm integrated and feeling my feelings, I can actually feel love.
People say like a life beyond their wildest dreams, and it's like my life isn't quite there yet, but my life is getting there. It's like I never thought, I could do a lot of this stuff I'm doing, so.
They just provide so much to create my own story, supporting me in my journey, not to make it a certain way, but to meet me where I'm at. So I have all of these things that I can take and utilize to create this beautiful thing for myself.
Because one of the most fundamental things is that when and I think I can speak for a lot of my peers, are here, we don't feel like we're being pathologized. I don't feel like I'm a patient. I don't feel like I'm sick, that I'm going to my place to fix me. I feel like a member of a community coming to see my friends and coming to see not my doctors and not my keepers and not my judgers and not my, my gods which dictate my health. I am seeing people who co-create my health with me.
Okay, so that set the tone. Again, I am Brian Allen, and I'd like to just, I'll share my story with you in a moment. I just want to share a little bit more about, what the beginnings and what we do at Quest. Let me get this out of here. So, our mission is to provide integrative healthcare services, community, and education to all people seeking a wellness-focused approach to living and dying. Quest Center is committed to providing the best integrated behavioral and physical health services. More than 72% of our clients are low income and or medically uninsured or underinsured. The Oregon Health Plan, as well as other commercial insurance plans, are welcome at Quest Center. Our philosophy: we believe people thrive when their physical, emotional, spiritual, and social needs are effectively met. We offer a wide range of services for individuals to create a personalized treatment plan. Our services are offered in a manner that creates community among our clients that promotes continual healing. One moment. Who we serve: our doors are open to all who seek a life of health and wellness. We strongly believe that all of our clients should have access to excellent service regardless of their income, insurance, gender, sexual orientation, religion, national origin, race, ethnicity, disability, veteran status, HIV status, or chronic health conditions. Our three primary service communities are low income, people living with HIV, and LGBTQIA2S+. We seek to provide a comfortable and honest space in which anyone can express themselves along the spectrum of gender and sexuality. Our commitment to evidence-based practice with at-risk populations is fundamental to our work and essential to the health of our community. All of our providers honor the diversity of our community members. And just scrolling down a bit, Center for Integrative Health was founded in 1989 by two friends, Dr. Lucia Marks and Lucas Harris. Quest was originally a psychosocial support service provider for people living with HIV/AIDS. Over time, we have expanded our services, but retained our holistic approach to medical and wellness care. Today, we strive to meet the needs of people who are facing barriers to their physical, mental, and emotional health. We endeavor to create a place of healing that is an inclusive, empowering, and safe community of support. Again, thank you all for coming to the workshop, the the last stand of the day. Again, I'm Brian Allen. I just want to give you a little brief summary of who I am. I'm a native of Oregon. I was raised in a single parent home with a sister. I have several other siblings as well. Went to high school. I graduated high school in '87. Went to high school in Eugene, Oregon. '87 was also the year of my induction into the Oregon penal system as well. I instead of going off to college, I decided I would hang out for a while and actually continue doing what I had been doing underneath the cloak of going to school. You know, my family didn't know I was gang banging and all this other stuff because I was in Eugene, Oregon, doing my square thing and coming back to Portland and doing, you know, what it was I was doing legally and whatnot. It was easy for me to get away with stuff again because when I'm in Eugene, Oregon, you know, there's, you know, don't nobody know me. I can kind of like be who I really was meant to be. And then when I came back to Portland, again, I was involved with, you know, illegal businesses and whatnot in gang life. So anyway, you know, that's you know, either the jail or a grave. So I ended up, like I said, going to jail for the first time in my life in 1987. Also, that was my oldest child was had been conceived at that time. So I ended up going to jail for a stint. And she was actually, the first time I held my daughter actually was in a courtroom, which was the proceedings that were taking place prior to me being sentenced. So I have a lengthy tenure with the penal system, and that has ended permanently in 2015, where I was released a bit early off of federal probation. For me, my story of recovery began actually while I was incarcerated in a USP Atwater. I have 14 years of active recovery clean, and 5 of those 14 years began while I was incarcerated in the federal system. Since I've been home, I attended college where I actually had a vision. I wanted to really service to the youth. So I started doing outreach work with a nonprofit known as Connected. And would do that. Actually, I was doing that from the halfway house, which I really wasn't supposed to be doing. Yet I did. Hard hit I am. And that's where I came up with the idea of like, I wanted to have more knowledge of, you know, the use of drugs. Let's say a kid was having a reaction or they had OD'd or whatever. They could call Brian because they're not going to call their mom or dad. And I have more knowledge about what's going on with them and send them in the right direction. Well, that turned into me actually going to my own preferred program of recovery. And because I didn't know how to function without my DOC and my criminal behavior, not just thinking. I led a what I call a death-defying lifestyle of crime for many years. And so I didn't know how to function. I just knew I was tired of doing what I'd done. And so that's how I got into my program of recovery. And that's where I really evolved and started to understand about character defects and addictive behaviors. And, you know, and also in school, I was attending college at that time to enter the cohort program. Fast forward, I ended up getting my, excuse me, my throat is parched. Anyway, I decided to go ahead and do some mentoring, whereas I started out in 2013, went to the first class, and I followed through. The second time, different scenario, I followed through, and I was hired on with a culturally specific agency, and that's where I got my beginnings. And it really, I should say the lessons I learned there were the professional lessons I still carry with me today. I always tried to have a professionalism about myself, yet and still I haven't lost track of the fact that I am here and that my experience with life is valid just as much as anybody else that may have a degree or whatnot. So fast forward to that, I actually had a friend that was a former colleague that said, "Hey, they're hiring at Quest." I didn't know what the hell Quest was at the time because I was actually trying to get on with another agency, right? So I said, "Okay, I'll check it out." About a month went by before I even filled in an application and whatnot. However, when I did so, I was called in, and just like you saw in the video, where the individual was talking about, you go for one thing, and then all of a sudden you get hooked. And that's what happened with me. I mean, when I went to the interview, it was not like anything I had prior, and I was well received. I mean, I had all these fears because, again, I was delving into the unknown. I didn't have any idea what I was getting into. And I'm glad I didn't fall prey to my fears and not take that step. I've been stepping ever since. So I've been with Quest now. It'll be 3 years in February. I was promoted to lead peer. I didn't really want the position. However, my department felt different. My supervisors felt different. Just in general, it was just like, you can do this. And I said, okay. And I took the position, and I still don't look at it as a position, although it is, and my check will reflect that. However, it is, for me, it's really affirming, and it feels good to be able to function in this capacity and doing something I've never done before. And so with in my department, the HIV SUD services, we offer a list of programs, such as the peer program, which I am the lead peer with. And basically, I have a group of individuals that when they first come in, I sit down, and like we stated on the video, we do a goal plan. Now that's just how I prefer to do it. However, each peer has the freedom and the platform to do their goal plans, maybe a week out or whatever, but it's about establishing the rapport and whatnot. Also, part of our training through the IPS model, the intentional peer support, and that is also the model that is implemented and used with co-reflection. Somebody gonna keep time? Also, so I sit down with the peer, and basically, it's about everything is peer driven, peer focused. So the peer themselves, I can, I give them a few some questions that I ask them prior to them saying what it is that they need assistance with. But it's stuff like, are you organizing? Would you need assistance with that? Or transportation, things of that nature. And then I ask, well, what does my role in your life look like to you? And they will say, well, I would, whatever that looks like to them. And they make up their own goal plan. Again, it's, I'm not a clinician, and it's really what the individual would like to do and how they would like for me to assist them in that capacity. my experience with that has, I've interacted with fellow peers that have been homeless and just wanting to do different within themselves, and individuals that they have chronic pain, or they're using substances here and there or whatnot, and it doesn't make a difference though. For me, it's just being of service to this individual in what capacity that they need me to do so. And again, this is a wraparound clinic. So I have, there's another group, it's called WOW, which is the Women of Wisdom. Now that is a program, a group that is for females and individuals who are female identified as well. It is a weekly program group, and it is it really embellishes and embraces the individual's wants and needs, and it really is a relationship built amongst a group of individuals. We also have the men's group, who is facilitated by two individuals that have lived experience, and it is for I'm getting stuck, but that's okay. It is for individuals that are living with HIV/AIDS, and it's a safe space though. That is also something that within orientation, I was invited to attend and take part of. So it's really hands-on with these groups. The other program that the the service provides is the From the Inside Out, which is a harm reduction based program that prior to the pandemic, I co-facilitated with another colleague at the Multnomah County Health Clinic. And that was, it was an open group, and I used the stages of change model for individuals to, like, where am I at within my recovery? Whatever that may look like. Again, it was harm reduction based, so it wasn't something where a person felt like they had to be doing this or had to be doing that, and they were met where they were within their journey. And that too was a weekly group. We also have a group that is Genderflux. It is titled the Genderflux Clubhouse, and it is an open and ongoing virtual support group for non-binary and transgendered individuals. The group also meets weekly and dialogues around lived experience and networks, different resources and whatnot. As far as support, peer support for us colleagues, those working there at Quest, we implement co-reflection, again, which is derived from the IPS model, which takes place every month. Whereas me and the rest of my peers, we sit amongst each other and we discuss our interactions with the peers that we work with, as well as any discrepancies that we may have just in general, or how we're feeling. We kind of like, we support one another. Again, it's peer driven and whatnot, and we play big on that. We conversate about where we're at and things of that nature. We also we also have clinical supervision that takes place every month as well for each of us. Another service that is provided is we have, you hear my voice? We have a service, excuse me, we have what is called a peer wellness fund, which actually each one of us has a fund that in case, we come across hard times or whatever, or whatever it may be, we can draw from that fund. So again, this speaks to health care, self-care and whatnot, which is really a big, if not the biggest component within the agency. And we make sure in the HIV services that we make sure that we are definitely on top of our self-care. We are able to, if we need a mental break or whatever you want to call it, we have that platform to do so. As far as our funding and whatnot, we have funding. One moment, please. Yep. We have funding from, it is a government fund known as Ryan White that's designated for agencies that work with people living with HIV and AIDS. So for me, I hope I covered everything. I probably didn't, which is another beautiful thing though, because at Quest, it's not about you having all your T's crossed and all your I's dotted. You're allowed to be who you are as you are, and to be respected in that capacity. So I believe that's all I have for now. I'm gonna pass the mic.
Brian, this is Marianne. Hey, were you going to answer questions at the very end or at the end of each of your?
I apologize. I would like to do it at the end.
Okay. All right. Thank you.
Okay. Well, my name is Kim. Thank you so much, Brian. I'm super nervous and my mouth is dry, so I apologize. It is so cool to be here. I want to say this is my 4th year at Peer Apocalypse. It's really cool to see some people that I know. There's been a lot of good information. I've learned a lot of things from being on some of the workshops, and yeah, and I'll be really glad that I like the end of the packet says that we'll see you in Seaside next year. So I'm excited for that, to get to go back to the ocean. Well, so let's see. Yeah, so my name is Kim. I work in the FSR program at Quest. I'm going to share my screen real quick. Let's see if this works. Can y'all see that? Awesome. All right. I did this all myself. I was so excited about it. So I work in the FSR department at Quest. We are drug and alcohol outpatient treatment. It's intensive outpatient treatment. And what we do is, well, I put our little statement down here. It's like to empower people to support recovery and wellness, to promote health and well-being, and to connect and help folks thrive in their own communities. So I am a peer, and which means that I'm also somebody living with mental health and substance abuse, disorders. And I have a lot of experience in how to use drugs and how to go to jail. And so what I know about that is that there's a lot of things going on when we try to come into recovery. A lot of times we don't know that what to do. I know when I came into recovery, I wasn't really sure what recovery meant, or what that actually meant. Just that I wanted to stop using drugs, and I didn't really think about my housing or my community or my health or any of that. Like I didn't think anything beyond myself. And so when I got here, when I decided to get clean, I tried multiple times. As we all know, it usually takes quite a few times to get there and maintain it. And the last time that I actually tried, something different happened. This lady that was claiming to be in recovery as well was telling me a story about herself. And I remember at that time, for some reason, I listened, and her story was very similar to mine. She had talked about being with the same kind of person that I was with, in the same relationship that I was with, in the same situations that I was in, feeling the same ways that I was feeling, hurting the same ways that I am hurting. And for some reason, I felt a little spark of connection, which I had never really felt before. I'd felt very alone for a long time. And And so it kind of started that path on changing the way that I thought, because I thought that everybody that used drugs was, and every person that used drugs couldn't get clean. I didn't think that they could stop. I didn't think that they could change their lifestyles. And so it was really nice to hear somebody else talk about that. So I made a list of like all these things that I am, right? And so it's kind of funny because like I'm a recovery mentor, I'm a peer supervisor, I'm a CADC1 candidate. Not that I want to be a counselor. I really like being a peer. I'm a felon. I'm a domestic violence survivor. I'm a victim, a participant. I'm a mother, a daughter, a friend, an artist, a recovering addict. I'm multiracial, and I'm a single mom. And with all of those things, right? Like it's really important for me to honor all of those parts of me and myself. And so coming to be a peer was kind of like Brian said, was not really my intention in the beginning. I just got clean and was starting to help and give back to the community, and I really loved it, and I appreciated it, and I enjoyed it, and I had seen that people gave to me, and then I was able to give back, and that really created this togetherness, right? Like this community and connection that we could continue that cycle, right? And so I came to Quest because the truth is that I'm in a 12-step recovery program, and my sponsor was working there. And she told me about this position, and I was like, I am so excited. You know, I found out about Quest and all the things that they were doing, and how it was a little different than a lot of places that I had been part of and that I had seen. And so I also had the most bizarre getting hired. I sat at a table with some people, and we talked about our recovery basically. And I had these kids that landed in my lap when I was 2 years clean. And they were really difficult to handle, right? They came with their own trauma and all the stuff that I had put them through, and they came to me, and I had a lot of trouble with it. And it was interesting. And so we got to laugh about it and talk about it and cry about it. And it was probably the best interview I'd ever had. And I got hired basically on the fact that I was a recovering addict who had issues and problems and could talk about them. Right. So that was great. So next, let's see. Oh, how do I go to the next one? Oh, here we go. All right. So more about Quest. So like I said, I work in an outpatient treatment program. Let's see, let me move this really quick. Our outpatient treatment program is, so who we are at Quest. I'm sorry, I have to move these little things around. So I just put that we're an innovative, humanistic group of folks. We're dedicated to supporting health and wellness of our communities. We're an outpatient treatment providers, and my team consists of peers, counselors, mental health providers, and supervisors. And we're proud to represent the communities that we serve. I mean, I would say 75% of our FSR team identify as being part of recovery communities. Over a third of our staff and providers and board of directors identify as members of the LGBTQIA2S+ communities. We value the voices of all of our staff and are given the freedom to bring in new ideas to the table. And I'll get into that at the end of my talk. I put example, multiple pathways to recovery, right? We don't force recovery on anybody, or our own ways of recovery. So who we serve, we kind of talked about that. We're an outpatient treatment program. We serve recovering addicts and alcoholics. Our primary service communities are low income, state insurance. We also have the Ryan White funding. So Ryan White funding also pays for people living with HIV. Sometimes they're also on disability on Medicare. There's funding for that. Ryan White funding will pay for outpatient treatment with us for them. Also, if you're underinsured or you have no insurance, we also have county funding that we can tap into, so that people that can't afford to get into treatment, because we all know treatment is overpriced, that they can also get services with us too as well. We serve people living with, a lot of our clients are people living with HIV and the LGBTQIA2S+ communities. I hope y'all can understand me. I know I talk really fast. Move on. All right. So what I want to get into is, so when people come to us, I usually am the first person to meet them, me or my coworker Fernando. He is another person on my team. He's a peer, and we meet with the people first, and we get to talk with them and make it try my best to make it an easy, comfortable, safe place to talk about your addiction a little bit, kind of like why you're coming to us, because that was a choice that they made themselves, right? Like I didn't push anybody into treatment. They get to come to us, right? So they get to tell us their story and how powerful it is to sit with them and kind of like when I sat with that lady and she told me her story and I got to identify for the first time, you know? And so once they get in, some of the services that we provide, I wanted to get into a little bit about this. So we have a holistic approach to services, but we also have a integrative services. So sometimes people get into our mental health services before they ever come to FSR, because we all know we don't always get clean first, right? Sometimes we do it backwards, right? Sometimes we want to start working on our health first, right? So maybe people start in a different service. Maybe they start with Brian first, and they start talking about their struggles with their taking their medicine on time, right? Taking the medicine the right way. Sometimes they're in mental health because, like for me, before I ever got clean, I thought that I had a mental health problem first, not a drug addiction. And if I stopped doing the drugs, my mental health would get better, but I didn't really look into that first. We looked into mental health first. And so they might start working on that first, and then we get referred over. And so people can be in multiple departments with us as they heal, because things alongside, right? We have a lot going on with us, right? So we get to work on all of those. But some of the services we provide are acupuncture. I wanted to talk a little bit about acupuncture because it was a service that I was provided when I got clean. And I had never done acupuncture before. And also when I came to get clean, like a lot of our people do, I hadn't had a lot of interaction with anyone. I hadn't been touched in a really long time or asked how I was doing. It's one of the really first genuine spaces that people get to go. They get to lay back in a quiet environment where it's nice and relaxing and peaceful, and get to rest their body a little bit, you know. They get acupuncture services that are, you know, it helps relieve you know, the cravings, and it helps relieve that detox that we go through, right? The inner turmoil that's going on. It helps to relax our bodies, because we do better internally and we heal better when our body actually can relax a little bit, you know. We offer Chinese medicine and naturopathic services. When you're in FSR or in mental health, you can see our doctors there, right? We have this different approach. So you can also see on OHP, you can see a primary care doctor with Western medicine, and you can see a naturopath doctor too at the same time. And OHP will pay for both. So just a nice little fun fact. We also offer yoga. I definitely wasn't doing yoga before I got clean. I was not touching yoga, first of all. And so coming in, we have all these nice little ideas that are so different from what I know, right? Like street world and using, and, you know, all the other things that people come from, you know, they're like in bathhouses and in like all kinds of just different environments from this, right? So getting to practice yoga, and we also have gentle yoga. You don't have to be, you know, a yogi in order to do it, right? We're just trying to get us moving the body a little bit, and just starting to pay attention, right? And starting to be aware of ourselves. Meditation, the mindfulness, you know. We have nutrition groups where we get to learn about how nutrition restores our brain, right? And the things that we're putting into our bodies, because we put drugs in our bodies for a really long time, right? So now changing the things that we allow into our systems, right? And it really matters, and it really helps. Fernando, my coworker, he runs a Zumba class. I don't know a lot of treatment centers that do Zumba, but it's fun, and he does that, and he runs it at our place, and he's a Zumba instructor, and it's a lot of fun. People like it. We have a cooking group. We have crafting and art groups. And then some of the main groups we have, relapse prevention. We have a sexual wellness group that I've run a couple times with a mental health provider. And I think it's really important to talk about our sexual wellness. It's not something that is generally talked about out loud for people to talk. It's a very, very vital, important piece of our lives. And so we make the space to be able to talk about that. And in our drug use, it was probably a big thing that happened as well, right? Drinking and using drugs, like sex happens, right? So we just want to talk about change the narrative of what we learned from like 5th grade about our sexuality and our sexual wellness to like now being adults. And when we talk about those things, I hear a lot of times people haven't talked about it at all since 5th grade, right? We have a process group, life skills group. The peers run the life skills group. I would think that that's pretty obvious that a lot of us, we try to practice what we preach, right? Like we want to be the example, right? And so a lot of the life skills that we have learned, we try to pass on to others, right? We have Rent Well, financial group, gender specific groups. We have non-binary, gender non-conforming group. We encourage people to be themselves, to be able to be themselves, to start finding who they are. And last we have, actually that's not last. We have so many more services. We have the Ryan White LGBTQ specific recovery housing, right? And that's one of the coolest pieces right now. We have Kayla in here who actually is our case manager for that house and does a lot of good work there. That is anybody that's in our treatment in FSR and the outpatient treatment, they can access this housing. And from what I hear, it's the first of its kind in Portland, LGBTQ specific recovery housing. We have 2 beds that are Ryan White dedicated to that. And it's been really cool. It's not based on your gender. We have a lot of men's houses, a lot of women's houses in Oregon. This is not that. And what I've heard a lot is that people, they struggle being in those houses, right? And feeling discriminated against and feeling scared and feeling not part of their community, right? Because that's what we're trying to do is find a community that we feel love and support and all of that in, so that we can thrive, right? Almost last. Last thing I put is just like connecting with your passions, right? This is where it comes in. This is where peers excel, right? So like when we're talking about trying new things, like we want to sit with people and we want to like find out what they want to do, right? It's not about what Kim wants, right? It's about what you want to do with your life. I mean, recovery is individualized. We come here knowing that we used to do things, right? Having things that we loved and enjoyed as kids or whatever, right? And so I want people to get out and try new things. And so Quest, like we're very open to letting our peers take people places and go experience new things. And we participate in AIDS Walk and Pride Northwest, and we've tie-dyed shirts. We create new groups, right? When clients tell me about things, when other peers are talking about stuff, I'm like, that's a good idea. We should make a group like that, right? And like we put it together and we do that, learning to dance, hiking, biking, running, exercising, the recovery walks, movies in the park, drag, artwork, singing, right? Picking up instruments that you set down a long time ago, right? Like I want to appreciate my recovery, right? I want people to appreciate their own recovery. And so, I just put it's recovery is not all about just sitting in meetings, although we do encourage people to go to meetings, right? Find that support. But it's not just that, right? Like we live a life outside of the rooms. And so it's something that we want people to enjoy, something to connect with and something that they find personal to themselves that they want to keep. Also starting a business. I don't know how many people I've known in recovery that have started businesses that have been amazing and super beneficial to their communities, right? Here we go, community. last one. So I just had a couple questions I just wanted to add for you to think about, or maybe you could add some answers in the chat, but I wanted to put like, what are you passionate about and what talents do you have? How does community play a role in all of these? And some questions to kind of leave with, like what interactions were the most important to you in early recovery, the most meaningful, and how do you give back to your community?
I want to speak to what you said, Kim. You know, obviously I work with you and Brian, but I do want to let folks know that we are so lucky, the three of us, the four of us, and a few other ones who are in the meeting right now, to be working with such a great organization that allows us to be able to, like you said, oh, why didn't I think about doing that group, you know, until a peer, you know, points it out. And then you have the support of the whole community and the whole organization saying, yeah, you should do that, blah, blah, blah. How can we help you do that? And I don't know, I can't compare it to anything else because Quest has always been the place where I worked at in relation to serving the community. But, you know, we're just blessed that way, and the support that we get, which also encourages us to do a better job for our community when we have that team behind us. So yeah, good job, Kim. Good job, Brian.
Thank you. Were there any other comments that anybody else want to share real quick before we move on to Stacy? Let's see. Michelle, I'm super passionate about supporting women along their health and fitness journeys. I used to weigh over 250 pounds and have completely transformed myself. It's not about being the fittest, it's about being healthy. Right. I mean, and all of it, what I really love is that everything is a journey. You know, they talk about like, it's about the journey, not the destination. And that's what peers are for, right? Like, that's why we're here, is to support people on their journeys to wherever it is that they want to go. Right. And usually it's a health journey, right? Whether it's emotional, mental, spiritual, like physical, all of that's really important to us. And so it's just finding about having a safe place for people to come to recover. I like the integrated part of us. We have one last group I want to tell you about. It's called the Link Group. And Link Group is kind of funny because it connects, you know, people together. But I said before, not everybody can stop using before they want to start working on their health, right? So people are in mental health and they're working on their mental health, and maybe they're still smoking weed, or maybe they're kind of drinking, but they're starting to explore that maybe it might be a problem. They can join this group, which is not a treatment program, which is not a plan for them. They can go to this group and they can talk about living with intention. That's what it's called, living with an intention and knowledge. And it's to create a space for people to start thinking about that, and to be able to talk about how they use marijuana for medical purposes or whatever it is that they're doing, but intentionally talking about the things they're doing, because we start with mindfulness and then we move on to whatever we want to do. So last of all, there's my little thank you fun picture. And yeah, and I'm glad that everybody's here. Thank y'all for letting me share.
Thank you, Kim. That was well done.
Thank you, Kim. Thank you, Brian. I'm Stacy. I am a peer at Quest also. I work in the WISH program. And Kim, your PowerPoint was amazing. I just have to say that. Very good.
Stacy just taught me how to do it yesterday.
So I'll tell a little bit about myself. So I'm a person in recovery. I also suffer from chronic pain. I am a child of parents who both have autoimmune disorders. My mom passed away at 58 and my dad is 65, and he actually is very sick right now. He's has an autoimmune, or I should say an immune compromised system, and he got COVID about a week ago, and he is currently in the hospital. And I am currently being tested for multiple sclerosis. So I am from a family of autoimmune disorders. I have a brother. He's the oddball out. I don't know what happened to him. He's the healthy one. But I got in recovery. I had a long life of trauma, abuse, domestic violence, you name it, I've, been there. I remember the first day I walked into treatment, I didn't think that I was able to do it. I remember telling my counselor that, she just didn't want to know who I was. She said, I want to know who you are. And I said, no, you don't. I'm a horrible person. And here I am, 6 years later, finding things out about myself that I never thought that I could do. So I came to Quest about 1.5 years ago, and literally this job was thrown at me. So I worked at inpatient treatment and I was bored with it. And I was sitting there one night just looking on Indeed and decided, oh, I think I'm going to apply for a job. And I went into the interview and I cried, and I told them my mom had just passed, and I cried, and we talked, and I've had 3 foot breaks in the last 1.5 years. So I was still suffering from a broken foot. And so we talked about that because the person that interviewed me is also a doctor. And so I got hired because I was grieving, and I was a person in recovery who had experience with chronic pain, and they welcomed me into their community. And that makes me emotional because I never realized that. So, what I've learned from my parents is that their chronic pain and their illnesses didn't define them. They are very strong people. They could have done things differently. My mom died at 58. She, didn't eat healthy. She died from a liver disease that she was diagnosed with in 89. She could have, drank the green juice, the smoothies and all of that stuff that she absolutely hated. She probably could have lived, another 5 or 7 years. So what I've learned that since being a peer and speaking to people who also have autoimmune disorders that suffer from chronic pain, there's ways to improve. There's ways to change our lifestyles to add a few years so that our kids don't have to grow up parentless or so with that, I will stop crying and share my screen. So the program that I work for is WISH. It stands for Wellness, Integrity, and Sustainable Health. The WISH program is a little bit different. We are a part of Quest, but the WISH program itself, we only take Care Oregon. I'll talk a little bit about that in the last slide. We do offer acupuncture at Quest and also all of the other services that can be billed separately. But if you want everything that's involved in WISH, Care Oregon is it. So WISH started in 2015. It was created to help support communities, sorry for my mistype there, communities and people affected by the opiate crisis, to show people that they can live with chronic pain without opiates. So David Eisen, who is our executive director and doctor of Chinese medicine, he's also an acupuncturist. He noticed that patients were in pain and needed more help. And so what he did is he got together with one other person, and they wrote up a concept, and they went to different insurance companies, state insurance, and presented it. It was originally with Family Care, and now it's with Care Oregon. So the WISH program has been around for 5 years. So what does the WISH program offer? We have a variety of groups that are all evidence-based practices used in treating chronic pain and chronic illnesses that have been proven effective over the past 5 years. So every quarter we actually talk with our peers, we get a survey, to learn how we can better ourselves and to see if this is actually working. We're the only clinic in Oregon like this. OHSU offers something similar, but right now we are the only clinic that offers what we offer. So right now, all of our groups, of course, are done online. Most of the time, all of our groups are in person. We are a community-based program, and so we like to have that connection with people. It's very intimate to be in a yoga room with 5 other people who suffer like you do, and to just have that connection and to heal together. So right now, all of our groups are on Zoom. It's a little bit different, but we offer yoga, qigong, meditation, and acupuncture. We encourage everybody to move at their own pace. So some of the peers that I work with are sicker than other peers. You know, I had 2 foot surgeries in the last, it's been 6 months now. So I participate in these groups and I'm not doing yoga with, foot surgery to feet. So, I was doing chair yoga, and what works for somebody might not work for other people. So I was always encouraging people to work at your own pace. And it's really easy with movement groups to actually, do what you can. We offer a healing skills group, teaching how we can live with chronic pain using different tools. So we actually use a program from the Full Center for Integrative Health. It's an 8-week program, and it teaches things like mindfulness, sleep, brain and pain, and then learning to do pleasurable activities. So like I said before, our pain doesn't have to define us. And then we also offer peer support. So peers started with the WISH program because the community needed something different. They wanted someone to walk with the patients through the program, someone who understood chronic pain, mental health, and different life skills. So just some different things that I do. I find myself different than a lot of peers. I don't necessarily help people in the recovery community. A lot of my peers are on pain medication or they're not in recovery. And so what I do to help is a huge one is navigating the health system. People come to us and they're broken and rejected. The medical world can be very frustrating. And so, navigating the health system is very important. Doctors, insurance, care coordinator. Care Oregon actually offers a care coordinator. It's very easy. The care coordinator does a lot. A lot of the people that I work with don't realize that there's more resources out there available through insurance that they're not told about. It's actually really, the insurance world can be very frustrating. It can be really confusing. And so making sure that everyone knows that there's more resources available than what's just out in the open. And then disability. I've helped people fill out disability forms and applications. Disability is also another thing that's very intimidating. It's another place where you can feel rejected and broken. And so that's where the understanding and hope come in, because you know, as a person myself right now going through the medical world and the medical journey, it can be really frustrating to advocate for yourself. And so that's where peers come in to help advocate. So a lot of our peers are also in mental health. We currently at Quest don't have a mental health peer. I talked to David Eisen last week, and he actually, you know, we're always trying to find a way to change things, and having a mental health peer is something that he's interested in. So if anybody has any insight on that, that would be awesome. You know, I also suffer from mental health. I have multiple diagnoses. I have, you know, everyday life that I live through. And so it's always easier to talk with somebody sometimes that's not a therapist. Like, you know, you go see your therapist and they just give you that look and say, how does that make you feel? You know, and sometimes you just want to be like, I don't want to hear that today. I need somebody that can relate. And so with that, we also offer coping skills, life skills, and then basic needs. A lot of people in the WISH program at Quest are on disability or no income, you know, or waiting for the disability to come through and have no way to work. And so there's a lot of money out there. There's a lot of resources out there. So food, nutrition, transportation, household clothing, parenting resources, childcare. It's insurance will pay for some of this stuff. And, you know, rent, all of that. So just a little information about chronic pain. 1 in 5 people suffer from pain. There's different types of chronic pain. There's, you know, chronic pain can be physical, or it can actually, your mental health can cause chronic pain. So our brain is a main factor with chronic pain. So one of our big, we have a 2-week, in our healing skills group that we do, we actually have a 2-week course that's continuous, and it talks about the brain affecting our body. And so if we can, you know, change our thinking and things like that, it actually can ease chronic pain. So the last one, mental health causes pain. Here's some statistics from SAMHSA. So more than 1/3 of US civilian non-institutionalized adults reported prescription opioid use in 2015, with substantial numbers reporting misuse and use disorders. Relief from physical pain was the most commonly reported motivation for misuse. Economic disadvantage and behavioral health problems may be associated with prescription opioid misuse. And so with that, of course, the results suggest a need to improve access to evidence-based pain management and to decrease excessive prescribing that may leave unused opioids available for potential misuse. So what I know is that opioids are supposed to be temporary, and for those that, you know, work with opioid misuse, what happens is they go in for a chronic back pain or something, and they get prescribed this, and they become addicted. And so finding ways to, you know, help manage that without the use of narcotics is our goal. And a lot of it is education. I mean, there's things that we offer that, not things that we offer, things that we teach that you just don't know, like you don't even think about it. So here's another statistic from, 2018. So substance use disorders impact the lives of millions of Americans. According to SAMHSA, in 2018, approximately 10.3 million people aged 12 or older misused opioids. I can't say that word, I'm sorry. In the last year, 2.1 million people aged 12 or older had a disorder. So in 2017, more than 70,000 Americans died from drug overdoses, including illicit drugs and prescription. So what's to come? So the WISH program is always changing, like all the other programs at Quest. We are a peer influence program. Quest is a employee influenced business. And so, it's all employees and peers and patients coming together to figure out what the best way to care for the community is. So when peers come to us, and have ideas for groups or have ideas for different things that they can do, that we take it to the team meeting. We always talk about it. So we're always looking for new insurance to offer besides Care Oregon. A lot of people would benefit from this if we did not just take Care Oregon. That's a huge hurdle. The next big thing that's happening is the WISH program has actually teamed up with Miracles, and they're opening a resilience initiative. So it's called TRI, and it's a substance abuse treatment and non-opiate pain management for the African American community. So they're still in the process of figuring all of that out, but it's in the works. So I wanted to also share, hold on. Just some more statistics that I wanted to share from Quest and also one from SAMHSA. So this is from SAMHSA. So main reasons for last episode of prescription pain reliever misuse among past year misusers 18 and older. So as you see, the biggest thing is to relieve from physical pain. So the problem with our society in America today is people don't realize how much nutrition affects pain, how much movement affects pain, how much our mental health affects pain. Alcohol, just smoking, all of that has a huge part in pain relief. And so the biggest thing is educating. There's not enough education out there. You go to the doctors and they say, here, take this, here, do this. And if I would have known that cutting out certain foods or limiting, certain drinks or sugars or, doing yoga twice a week would completely help my movements and my pain levels, I would have done this a long time ago. So, as far as the other ones, it's definitely not as high as relief from physical pain. People go to the doctors for help. They go because they're desperate and, this is wrong with me. You're not listening. And then the doctor says, here, take this. So, as far as the Western medicine and Eastern medicine, we offer a holistic approach at Quest. But a lot of the people in the WISH program still have to go see their regular doctor. They have to go to a PCP. They don't have that opportunity to just see a naturopath. So that's where the education on, using different things to help relieve the physical pain and eventually it becomes a lifestyle change. So I also wanted to show you this one. So this is actually from WISH. This is from one of our surveys that we did. So you can see that there was 17 people here that responded to the survey, and you can see how big of a difference that it makes with all of the services, including the movement groups and the nutrition class and the acupuncture and the cupping and the qigong, all of that stuff combined together, it makes a big difference. So I always like this quote from a WISH client. When I started, I was hopeless and desperate. Pain management was only the start of what has changed in my life. Quest is truly a magical place. I have gone from thinking there was nothing to live for to bring it on. So, we are not our pain. Our pain doesn't define us. And yeah, thank you.
Thank you, Stacy. You guys were marvelous. You guys were on point with your presentations. Was there any questions for Brian pertaining to any of the services or groups that I had mentioned earlier?
So there was a couple of questions early on. So Joan was asking how she could hook up with the online peer group for gender flexible, non-binary folks.
Yeah, so I put in a chat box for any services or groups or whatnot. You can actually contact Justine DaCosta at j.dacosta@questcenter.org. They also do the intakes and things of that nature. And my information, I was going to put it in a chat box. I actually have to get going out to pick my son up from school at 2:30, and it's raining. But I'll put in my information as well. Does that answer your question as far as?
It does. I do have one quick question. Is like, I assume that people have to be a part of the Quest family or, sign into or accepted into services to have that kind of a support group. But if anybody knows of any general public support group for people that are non-binary or gender flexible, I know several people that are just starving for that kind of support, and COVID has been really hard on them.
I suggest you, we definitely offer services for that, and I definitely suggest that.
We are working on that, trying to open up the doors for people who are not necessarily clients at Quest, but for the community as a whole, where you don't have to be necessarily active with Quest as a client. So we are kind of looking into that, especially for
that would be amazing, Alex, because I've checked into the Quest Center, the Q Center, and they have some good stuff, but this, these people don't even have SUD issues. They just need support. And yeah, thank you. Just let me know. I would support that in any way.
I was gonna say too, unfortunately, because of COVID, we don't do a whole lot of things in person anymore, but we used to have like on the video nutrition night where anybody from the community could come and we would eat together, and you could take food home with you, and it was a really cool place for everybody to come together and meet and hang out.
So I would just add that these folks are from Tillamook and other rural counties where they're really under a lot of pressure right now in their mental health issues. And online would be perfect because there's literally nothing on the North Coast for anybody that's gender fluid. It just doesn't exist. So let me know. I mean, I'd support it in any way I possibly could.
Thank you, Alex. Thank you, Kim.
And Brenda also asked how she could get involved with supporting this great cause. So I don't know if Brenda's still on, if she wants to speak to that question.
Yes, I am. Hi. I was just wondering how, like, do you do volunteer services, peer support, anything like that? Because I love the Quest Center. I'm so glad to learn more about it.
Imagine it. Oh, Kim, you got it? Sure, go ahead.
Oh, actually, I don't know. It depends on what department you're interested in getting into. But you could, I'll put my email in the chat as well. I'm sure there's definitely opportunities to be of service. We, because Nutrition Night is not happening anymore, we do get donations of food on Thursdays, and we deliver food to people. I know we're always looking for people to drive food to people, so that might be something.
Oh, I could do that. Yeah, for sure.
All right,
Okay.
I'm gonna put my email in the chat.
Okay.
And we're starting to, now that people are getting, vaccinated, we're starting to get back into our community days. So, coming up on the 15th, we have the plant exchange. So, if you reached out, there might be some room there.
Actually, I'm sorry, that's actually next week on the 15th of May between from 12 to 1. Which you can come and share your plants. You can do a plant exchange or come get a plant, just get a free plant and whatnot. So it's a good time to, and it's COVID safe. It'll be spaces and all that good stuff. So
That sounds
sorry,
great.
I gotta get going.
I don't see anything else in the chat. People just saying that, it's wonderful. Absolutely love the graphics. Just information that you've already provided about how to get your website, and yeah.
Right. Well, thank you everybody for coming. I don't have anything else. It was really nice to see everyone, and yeah. Guess that's the end.
Please enjoy yourself.
Thank you,
no
Quest
matter
family. Yeah, there's a lot
Thank
of us
you
in
all
here.
so much. That was an amazing presentation.
Love you guys.
Oh.
Thank you, guys.
It's
I know.
amazing to see you.
Joan, have you
What's
checked
going on,
out the
Brian?
Q
Good to
Center
see you,
online?
man.
I'm sorry?
You too,
Have
man.
you checked out the Q Center online?
Yeah, I've been there.
I
I'm
gotta go
really
get my son. I'm sorry.
Go
Thank y'all.
ahead.
Thank everybody for coming.
Bye,
Okay.
Brian.
Bye, Brian.
I know.
Q Center is great. Q Center is great.
I was just wondering if they had any groups.
Nothing. Well, they do have support groups, but it's not yet peer based. I mean, it is peer based, but it's a little different. It's community based, which is amazing. But
Maybe we should create one.
I mean it. I mean,
I would Zoom. You can do anything.
I would do whatever. I mean, I see it again and again and again. The need is just is heartbreaking.
Yeah.
So.
Thank you.
Yeah.
Great job, everybody. You did a wonderful job.
Thanks to Lando. I saw we have memory pictures from Seaside back when we actually got to go.
Oh,
I know.
I'd love to see
I
those.
know. I can't wait till we get back there.
I know.
Next year
It'll
it's
be so awesome.
Seaside.
Yes.
I'm going to stop the recording.